Okay, why don't we get started today? Hello, my name is Melinda Frost, and I work for the World Health Organization Health Emergencies Program, and I'm the unit head for Learning Solutions. So thank you so much for joining us today. It's the last in our series of webinars around planning for sustainable financing. Today, we're going to focus on finalizing the Pandemic Fund proposal, and we're joined by a number of really wonderful presenters. So I think it should wrap up this webinar series quite nicely and answer any remaining questions that you have. So the specific objectives for today are to finalize the pandemic fund proposals, and in order to do so, to summarize key information regarding proposals involving WHO, FAO, and UNICEF as implementing entities, and then to emphasize relevant details from the Pandemic Fund Secretariat for countries in the final stages of proposal development. We'd like to invite you to please introduce yourself by utilizing the chat function there. Please tell us your name and where you're coming from, what organization and what country. I'd love to learn a little bit more about our participants here. If you have questions throughout the webinar today, please go ahead and enter them into the Q&A function in Zoom. We won't be taking questions live on air, but we will be taking them out of the Q&A function there. And we also have received a number of your questions prior to today's webinar, and we'll be trying to answer those as well. Okay, so with that, we'd like to introduce today's presenters. We're joined by a number of different implementing partners, so it's an exciting and well-stocked program for today. First, we're going to be hearing from Ankana Santaprichatit, who is the Program Area Manager and Administration for Management and Administration for WHO's European Regional Office. Next, we'll hear from Tanya Belcheva, who's a part of the Public Partnerships and Management Program with UNICEF. Next, from Katrin Taylor, who's the Program Officer for Partnerships and One Health from the Food and Agriculture Organization. After that, we'll go to a couple of Q&As for these implementing partners, and then we'll wrap out the program by hearing from Priya Basu, who's the Executive Head of the Pandemic Fund Secretariat, and then we'll also have a second question to answer following that. So with that, I'm going to turn it over to Ankana today. Ankana will be sharing a little bit more about what countries should know about the proposals with WHO as an implementing entity as they finalize their proposals. Ankana, thank you.
Thank you very much, Melinda, and good morning, good afternoon, colleagues. So I'm happy to be here. Next slide, please. So it's just a quick reminders of multiple areas that at this stage of the preparation. First of all, I think we need to ensure that the whole proposal is telling a story, the intended story, coherently. What are the national priorities that would be addressed with the fund being requested by the Pandemic Fund? Do those national priorities align to the priorities of the Pandemic Fund? That's very important also. And how the alignment of those relevant, how about the alignment also to the relevant regional frameworks and strategy, such as WHO also have the regional sovereign frameworks, for example, and also other applicable global strategies. So that just something to keep in mind when you're finalizing this proposal at this stage. Also, the ensuring that the linkage of the linkage to the current country resources like the NAPS, the JE, the SPAR, how the proposed action that being proposed in this proposal could help improving the JE or the SPAR scores, for example. Right, and in as WHO as the implementing entity, we also suggest to use the health emergency preparedness response and resilience or helper as a framework when developing this proposal. Another area as a reminders is around the collaborations. is very important, and also the priority of the Pandemic Fund in this second round for us to demonstrate how we, being WHO or the other implementing entities, are collaborating to support the countries in implementing the areas of the priorities, the national priorities. And we need to ensure that the activities for each implementing entities are clearly defined, the budget associated to it, and also being able to explain how together when all the implementing entity collaborate and support the countries in implementing those, how are we working together in addressing and help the country strengthen the priority areas or delivering the results. And two cross-cutting areas that has been emphasized and it's important to demonstrate this is around the engagement with the civil societies and communities in the countries. And also on the gender equity and the principle of the inclusion are also important, two cross-cutting areas. And just a reminder that we have the resource here at WHO at 3 levels of the organization, at country office, regional office, and also at headquarters at your disposal. If the countries would like to access those technical experts results, please feel free to reach out to us. The WHO country office, the entry points, which can refer to the experts at the regional office and headquarters. Please do use us to help you finalize the proposal. Next, as a reminder, is on the budget part, which is very important. As you already know, that there are so many budget tables. At the end of the day, those budget tables has to be, aligned and support each other. For the multiple country proposal, we need to also ensure that the budget for each countries is clearly defined, one sheet, one countries. Right, and also within that budget, already mentioned earlier, the budget for each implementing entities is also have to be clearly defined. And learning from also the first round on the admin fee, each implementing entity has its own rules and procedure, and also the pandemic fund guidance. So we need to take that into consideration, keep that in mind, and ensure that it's aligned with the pandemic fund policy and also the implementing entity policy. For WHO, this means 7% PSC, program support costs. Also, for the multi-country proposal, the countries also need to ensure that there's agreed criteria on how the budget is split between the implementing entities, right? It has to, and also to the countries. And that has to, we suggest to follow certain criteria to be able to explain why this country is requesting this much of the budget, while the other country is requesting maybe lower or higher. So maybe some kind of the agreed criteria to apply to that. And also two very important thing on the budget part is to demonstrate the co-investment from the country. Right, at the end of the day, the pandemic fund is just one of the funding source as part of the overall country's own initiative on the sustainable financing. And what the pandemic fund would like to see is what the co-investment on certain activity in this investment that the country is asking for, and also from the implementing entity point of view, what are the co-financing that we bring on the table for WHO country office. We need to know what are the expected funding sources to help co-financing certain activity in this proposal. Although we are still talking about the proposal and the fund is not yet approved, very importantly also, we want to demonstrate how are we being ready to implement if the proposal is funded. It's not mandatory, but WHO is strongly recommended to also include the plan for the project management and the steering committee. This would help defining who does what are the concerned ministries, the entities, and so on, to implement this, what are the functions in this project, and also the details on the work plan and procurement plan for this project. Once everything is ready, we have to go through the internal clearance process for each entity. For WHO, this means to create the opportunities in the online system called SEM. Follow the existing policy in WHO, so not to mention the details here. And also very importantly that I would like to highlight here is that requesting the country office to also include the focal point at headquarters and regional office as a collaborator when you submit the proposal online. Just very quick one on the next slide, please. This is just a reminder from the lesson learned we can draw from the first round of the implementation. WHO has analyzed the 108 proposals that were not funded by the Pandemic Fund in the first round, and there are areas for improvement. So we don't want to have the same, to put anyone in the same situation. So these are the area to consider that on the collaboration, on the gender, the two cross-cutting, the budget part and the activity and implementation plan. So the bottom line in conclusion, the next slide, please. The quality of the proposal is very important, and we all wanted to celebrate at the end of this year on the proposal being funded. So let's together make it more difficult for the Pandemic Fund to make the decision which proposal to be funded. Thank you very much.
Great, thanks so much, Ankana. So next we'll move to another implementing partner, UNICEF, and we'll be hearing from Tanya Belcheva about any specifics if you're using UNICEF as an implementing partner in your Pandemic Fund proposal. Thanks, Tanya.
Good morning and afternoon, colleagues. Greetings from UNICEF. My name is Tanya Belcher. I'm a partnership manager at UNICEF, and I support offices with pandemic funds grant management, budget guidance, and proposals review. Next slide, please. Okay, this slide is very jammed, but we wanted to illustrate the overall results framework of the Pandemic Fund that the Pandemic Fund uses and highlight the areas where UNICEF can best support. As you can see, the framework is grounded on joint external evaluation protocol and the accompanying tools for planning and measuring progress, the NAPS, the JE, the SPAR. So accordingly, successful applications will align with contributions to these results areas. While links are direct, some require more careful consideration. And it's good for UNICEF people to also know that some proposals have included other results areas than the highlighted one. The highlighted areas are the most likely ones for UNICEF to be involved in, but it's not exclusive. If you look at these tools, you see where community health workers platforms come in, where environmental health, water surveillance comes in. UNICEF seeks to maximize the opportunity of the Pandemic Fund to ensure focus on community engagement, civil society involvement, gender equality, and broader equity considerations in project design and implementation. What you can use as a key reference internally is the newly released UNICEF Operational Response Framework for Public Health Emergencies. The framework builds on existing strategies and policies and outlines UNICEF's added value and comparative advantage, and our role as a predictable partner responding to public health emergencies. Leverage the fact that UNICEF's works are scaled and multi-sectorally. We have multi-sector expertise and programming experience in health, nutrition, education, war, child protection, and social policies. UNICEF also operates the largest humanitarian warehouse globally. So these are the areas we wanted to flag to you that can support you, where UNICEF can best support and where you can focus your proposals on. Next slide, please. Here, I would like to explain the pandemic fund cost categories in UNICEF terms. Category A, which is project funds that will be passed on to the beneficiaries or delivery partners for implementation activities. These are direct project costs to be generally implemented through country entities, regional entities, and or delivery partners. Delivery partners are NGO expert consultancies, vendors. These are the costs associated with activities contributing to the project component result. So directly contributing to the implementation of activities that are embedded in the program. Examples are transfers of cash assistance, transfers of program supplies. That will be some examples in UNICEF terms. Category B is project funds that will be used for implementation activities by the implementing entities. These are also direct project costs at the country levels that are linked to the project implementation, such as policy advisory, technical activity support that are needed to achieve the program results. Such costs will vary based on the national and partner capacity, but are expected to be minimal. Direct project costs can also be treated as part of co-financing if you already have resources in place and some of it is covered by other funding. The cost of project monitoring should be budgeted under B as well. The only cost that we expect to see here data monitoring and evaluation should be country level costs that to meet UNICEF's program assurance policy requirements. If, for example, UNICEF has been tasked to lead a specific project result related to monitoring, for example, a specific study or evaluation, that is then part of the overall program delivery and will be budgeted in section A. A and B will be the total programmable cost, what we call programmable cost in UNICEF. And then we come to the implementing entity administrative fees, which corresponds to UNICEF HQ cost recovery rate, and it should be 7% of the programmable amount. So if the total of A and B, let's say it's 1,000, then the admin fee would be $70. So it's a percentage of the total programmable amount. For projects operating in challenging operating environments, fragile and conflict-affected situations, small island developing states, an additional amount of, i.e. admin fee of 3% may be included, and this would be made directly available to support offices' activities related to preparation, administration, and supervision of pandemic fund grants. In the project-specific framework and associated cost table, there is an Excel table that you need to populate. There are columns where implementing entities are asked to assign responsible parties for the activities that are listed. We just want to remind you that even if delivery partners will be contracted, UNICEF retains the overall accountability for the deliverables, even when we subcontract. So please also list UNICEF when you list potential implementing partners. Co-financing is the resources required from implementing entities and other sources such as bilateral aid agencies, philanthropists, potential future private sector sources of funding. This is in addition to the grant requested and will be received from the Pandemic Fund to implement the project, will be used to implement the project or part of the project for which the funding proposal has been submitted. The co-financing can be both cash and in-kind contribution. Next slide, please. Here, a few reminders, quick reminders related to process and options for support for the offices that participated in the first round of proposals and were unsuccessful. Reminder to acknowledge and incorporate the pandemic fund's feedback if they're reapplying. Collaboration across government partner and implementing entities and CSOs is important to build strong proposals. It is critical to have established open channels of communication across all partners. All proposals where UNICEF is an implementing entity must be shared and cleared via our PPT office prior to submission. We're requesting around this to be received around 10-12 working days in advance of the May 17 deadline. Please share proposals even if they're still at draft stage. We're looking at broad issues, not so much the nitty-gritty. Please also remember to share the relevant tables and annexes, as this is where we can clearly see the accountabilities of UNICEF and all the commitments to co-financing. Please send your draft proposals to me. And then if additional support is needed, you can reach out to focal points in Program Group Health Emergency Supply Division. If you're not sure who to contact in HQ, you can reach out to me first, and you can also reach to regional health advisors that can provide guidance. This is all from UNICEF. Thank you for your attention.
Great. Thanks so much, Tanya. Very, very informative. Okay, so next we're going to move on to hear from FAO and Katrin Taylor about if you're using FAO as an implementing unit, implementing entity, what to keep in mind in your final proposals. Thanks, Katrin.
Hi, lovely to see everybody. Yes, my name is Katrin Taylor and I work as Strategic Partnerships Officer in One Health in Rome, working with colleagues, of course, in the regions and countries. And very nice to follow WHO and UNICEF, because you've said many points that I don't need to repeat. But just wanted to say, I noticed here that we have India, Palestine, Zambia and Ethiopia online. And of course, you are the experts from last round. There are a few things different, but I think also networking with your colleagues in successful country proposals from the last round is a great idea, as long as they don't mind having a phone call or an email. Okay, so next slide. Right, so here are some key ingredients. You'll have heard many of them, but of course, from an animal health, One Health perspective, FAO really would like to join up across this spectrum. So making sure that the Ministry of Ag or Livestock, etc., is involved in these dialogues, and that often starts for us with our chief veterinary officers to join up in terms of how they can add to pandemic prevention, given the wildlife, animal, livestock, human interface. I think we've said that already. WHO underlined it, the importance of being demand-driven, nationally driven, not implementing entity-driven, and so that these need to fit in with the aims and ambitions of the government or the regional body. We like to partner. In fact, FAO, we say, do not go alone, because we want to partner with other UN and also with the banks and various other organizations like CEPI and Gavi, Global Fund, etc., who are all considering their role. So it's all about partnership, and I think this is the beauty of the fund. And also not only partnership at the implementing level, but partnership at the delivery level, where we are actually, if you like, subcontracting, but in the sense of honouring the structures that are already in place and empowering those structures at national level or regional and international level, that when the project ends, that those capacities are left behind. So, of course, it's all about the three priority areas. I think we know them inside out: collaborative surveillance, labs, and workforce development, with a heavy dose of making sure we get to the first mile, we like to call it, getting to the rural areas and community engagement, which is, of course, where pandemics, if we're going to prevent them, often start. And then the leverage part, we've had quite a few internal seminars on this, but if you're really going to leverage, it's the governments that bring their co-investment and co-finance, but of course it's the banks that bring their loans on top of what the grant brings. So the leverage is very important. So next slide. So what does FAO do? Because we're all getting to know each other better. I think sometimes at country level, you know each other better than we do at global level. But, we're all about strengthening the animal health sector to prevent or detect pandemic threats, spillovers. I think with COVID, we all know that things spill over, and we can only look at this with a truly One Health approach. And we really do have feet on the ground in terms of experts, veterinary services, extension services to help with early warning, surveillance, collecting samples, testing samples, down through to the technical areas that many of you know better than I do, but genomic characterization, sharing information, and then that risk communication and equipping workforce. So all of this, of course, being embedded in some better planning, if you like, and action and priorities at the national and decentralized levels. So things, again, as I said, are left behind when the project ends. And we're all trying to move indicators together, the indicators where they exist. I know that some countries don't have all the indicators that are referenced in the Pandemic Fund, but the JEE, the PVS scores, making sure that we are moving the same indicators. And again, that's something where we need to join up so we can all celebrate the success of turning, an event round. Next slide, thanks. So the myriad of actors, the government in orange, the regional bodies in orange are the most important in this process. It's a hugely complex, I'm sure Priya would agree, a hugely complex proposal to put together. And it was amazing last round what countries and regions, multi-countries did. And I know you're all working very, very hard to collaborate across governments and across stakeholders. But then in blue, you have your implementing entities who are also, we're all trying to share the work plan. While we manage the funds separately, we manage the action and the proposal, the project together. And then the important delivery partners, as mentioned before, there's international. For us, we work very closely with organizations such as WOA, but also not forgetting the national institutes. For us, again, the veterinary services, to empower and work through them. So very important, a myriad of partnerships that add value and also eliminate, hopefully, redundancies and create greater impact. So I think this is my last slide. Checklists. Nobody likes checklists, but I was pleased to hear that WHO and UNICEF are requesting to please see all the proposals, particularly being checked off, if you like, at regional, but also at HQ level. We need to know, being responsible as implementing entities, what the right and the left hand is doing. So we have a pandemic fund checklist in the guidance, but we also, for us, have an FAO project checklist. And it's not only about technical quality. I think we're all very, very good at technical quality, but it's also about operations. Can we deliver in time? Can we make sure that the budget is adequately flowing and aligned to the priorities? And that budget is also very, very important, because we have our own rules in terms of budget agreements and how we follow through. So we have a very quick checklist at FAO, and once that proposal has gone through that checklist, then the proposal can go in with delegation of signature. So thanks a lot.
Great. Thanks, as always, Katrin. Very, very informative. Okay, great. We're going to move on to some questions that are coming in. I'm going to go to you first, Katrin, and then I think Tanya, and then Ankana. I'm asking you questions that are about implementing entities as a whole. So please answer in the spirit of answering it as though you were also the other implementing entity at the table today. So Katrin, we have a question. Can we, as in I suppose the proposal writers, also engage an implementing entity as a delivery partner?
Very good question. So I will answer on behalf of implementing entities. It's taken a lot of work, and again, Priya, I'm sure you can nod at this, to be recognized as an implementing entity. And for us corporately, it's a very important piece that we are, if you like, equal partners, right? So when you start subcontracting, the partnership is a little bit skewed to being, accountable and responsible to that partner. And because we've, if you like, passed the test to check, that we have the capacity, we have the also fiduciary policies, procedures to be an implementing entity, I think we all want to be seen as an implementing and equal partner. So certainly that is what we're pushing. Shall I leave room to say yes in very, very unusual circumstances? Possibly, but I think we all need to negotiate our role as implementing entities in front of governments and be accountable to those relevant government ministries as well. Thanks.
Great, that makes perfect sense. Okay, good. So I'm going to go on and ask Tanya a question, and this has to deal with writing the proposal from Ministry of Health sort of staff perspective and also wanting to include CSOs. So the question, two-part question is, if the proposal is addressing the Ministry of Health system and building the capacity of Ministry of Health staff, how can CSOs be included, since the proposal will also beyond sort of the central ministerial level? And another way to think about it, sort of another similar question that came in, how to involve CSOs if the proposal that's being drafted is to address the central ministerial level systems. Can you help us answer that?
I can try. I'm not really an expert on program side, so I can defer. If officers have further questions from UNICEF side, we can check with our program group colleagues. But in principle, my understanding is that you can contract delivery partners, and it really depends on the capacity and capacity building and if they have a comparative advantage in a specific area that can support the activities that we're working on to implement with the ministry. In that case, it will justify subcontracting a CSO to help deliver these activities. So it really depends on the national context and how strong the ministry is and how much external help is needed. But if this is really needed to deliver the results, I think it can be justified, and there are places in the proposal where this can be flagged that a CSO would be helping.
Okay, great. Thanks so much for addressing that. I'm going to move on to Ankana now. The question is around co-financing. Can you please elaborate on how much and what should be included for countries when they're including WHO or UNICEF or FAO as an implementing entity?
So thank you for the question. We in WHO, we did not really have a very specific guideline on how much it should be included. It really depends on the activities and the funding that is currently available or anticipated to be coming from WHO core funding side, and also the resource mobilization that the country and regional office and also headquarters has been putting effort in those areas. So whatever that is currently available or anticipated with the high probability to be included in as the co-financing. And even the existing staff who will be involving in the helping the implementation also, that could also be costed and also present as the co-financing from WHO side.
Okay, great. Thank you. That's very clear. We're going to move on to the final part of today's webinar program to hear from our colleague at the Pandemic Fund Secretariat. If there are additional questions that you have specifically for WHO, FAO, or UNICEF, please go ahead and put them in the chat. We can try to answer them live today, or we will collect them and pull it into an FAQ and share those later. So with that, we're going to move on to Priya Basu, the Executive Head for the Pandemic Fund Secretariat. We have a lot of questions from you, Priya, so please let's hear from you, and then we'll go to questions afterwards. Thanks.
Thank you very much, Melinda, and hello, everyone. Good morning, good afternoon, good evening. I understand there's more than 100 participants, so it's great to see so much interest in the Pandemic Fund. So I'm Priya Basu, and I'm the Executive Head of the Pandemic Fund. Let's move on to the slides, please. Next slide. All right, great. So I'm going to talk to you today about what countries should consider and what they should keep in mind while reviewing their final proposals. Just as a reminder, the key parameters of this second call for proposals in terms of eligibility, all countries that are eligible to receive funding from IBRD and or IDA are eligible to apply. The 16 countries that received single country grants under the first call for proposals are not eligible. And those are, they're not eligible to apply for a single country grant. They can be part of a multi-country or regional proposal, but those 16 countries can't apply for a single country grant. And those countries are Burkina Faso, Bhutan, Cabo Verde, Cambodia, Ethiopia, India, Kazakhstan, Moldova, Mongolia, Nepal, Paraguay, Suriname, Togo, West Benghazi, Yemen, and Zambia. In terms of the funding envelope, the envelope for the second call for proposals, as you know, is 500 million in total. The maximum that a single country proposal can request is 25 million. And the maximum for a multi-country or regional proposal is 40 million. So this is a change compared to the first call where we didn't have such ceilings. In terms of the types of proposals accepted, we will accept 3 types of proposals: single country proposals, one country and one or more implementing entities, multi-country proposals defined as 2 or more countries along with 1 or more implementing entities, and then regional entity proposals, 1 regional entity and 1 or more implementing entity. In terms of submission limits, an individual country may submit a maximum of 1 single country proposal. So we encourage all different ministries that are interested within a country to submit, to please coordinate with each other and make sure that the country works together and submits only 1 proposal. There are no limits on the number of multi-country proposals that can be submitted, nor on how many an individual country or an implementing entity can take part in. And then thirdly, regional entities may only submit a maximum of 1 proposal for the same geographic region. So there was a question, I think, around this. So again, only 1 proposal for the same geographic region, but they may submit multiple applications covering different sub-regions. Next slide, please. Some key principles that we'd like everyone to keep in mind when developing proposals, and this was also highlighted by our implementing entity partners that presented before me. So first of all, the Pandemic Fund really encourages a coordinated, collaborative, and coherent approach to pandemic prevention, preparedness, and response, which means that we would like the proposals to bring together key actors, both domestic and international, engaged in PPR and health systems financing, and linking financing with existing country or regional planning and prioritization processes. So really, we want to bring more coherence into funding streams centered around country plans, national action plans for health security, for example, or other similar country plans, or regional plans, thereby strengthening alignment and complementarity and creating a more systematic dialogue about domestic or regional financing for PPR. So what does this mean? This means we would like to see the proposal demonstrate collaboration among various concerned implementing entities, among the concerned domestic agencies and actors and government ministries and civil society and so on. So really multi-sectoral approaches, and then between the concerned international and domestic actors. The second key principle that I want to highlight is the focus on demonstrating a leverage or catalytic effect. So we would like proposals to demonstrate how the Pandemic Fund grant will mobilize additional co-financing, that is from implementing entities and or other international sources, as well as co-investment, which is from the beneficiaries themselves, as long as, of course, if the beneficiary country is in a state of debt distress or at risk of debt distress, then cash co-investment is not a requirement. But if not, then we do encourage co-investment in cash as well as in the form of policy commitments. And then thirdly, a strong focus on equity. Proposals should demonstrate how they promote greater gender equity and broader health equity, and how they've engaged civil society and community groups, both during the preparation of the proposal and also during implementation. Next slide, please. A few other things to keep in mind. If you've received feedback from a submission in the first call for proposals, that is if you had submitted and you were unsuccessful in the first call and you received feedback, then please make sure to address that feedback in your new submission. Another thing to keep in mind, most of the successful proposals from the first call did demonstrate clear evidence of multi-sectorality and a One Health approach. So this is something to keep in mind for your submission in the second call. As I mentioned earlier, we do, we do place an emphasis on that because strengthening capacity in countries or at the regional level for pandemic PPR really does require multi-sectoral approaches, all of government and actually all of society approaches. Thirdly, the more evidence you can provide in your proposal, the better. It's useful to include photos, rosters of meetings with community representatives and CSOs, evidence of co-financing commitments. Earlier when I was talking about demonstrating gender equity, demonstrating involvement of civil society, it's not enough to sort of just say that civil society was engaged, but which civil society organizations were consulted during the preparation, and specifically, if you can provide information on which organizations will be involved in implementation, that would be very good. The more concrete evidence you can provide in your proposals on things like CSO participation, community organizations who are participating, and so on, the better. And then lastly, another thing to keep in mind, if your country is participating in a single country proposal as well as in a multi-country proposal, then make sure that those proposals are complementary and not duplicative. Next slide, please. This is a very busy slide, but just to give you a sense that the Secretariat will undertake a screening for eligibility along several dimensions. And these are all clarified in the portal, but was the proposal received prior to the deadline? Is it clear and legible and submitted in English? Is the applicant eligible and submitted by an approved entity, and so on and so forth. And I think these slides will be shared with you, so I'm not going to go through each and every one of these items here, but just to say that when the proposals are submitted, then the Secretariat will do a first level screening, and then it will pass on. Next slide, please. The proposals, once they are screened, then the eligible proposals will be sent up to the technical advisory panel, and the technical advisory panel will be evaluating the proposals based on a methodology that has also been made available, and there'll be five elements, 5 broad categories through which the proposals will be weighted. The first is on scope and objectives of the proposal, targeted core capacities, key activities and expected outcomes, and theory of change. This will get a weighting of 25% of the total score. B, rationale, demonstrated needs, alignment with national, regional priorities and plans, also 25%. Co-financing, co-investment, and overall available funding. This gets a weight of 15%. Ownership, commitment, coordination, collaboration, and co-creation. This is all about country and or regional ownership and commitment, and then coordination across those different national and international actors that I mentioned earlier. And then lastly, implementation, monitoring and evaluation, and alignment with the results framework gets a 20% weight. So that's how the proposals will be evaluated by the technical advisory panel, which will then make its recommendations to the board of the Pandemic Fund, which of course then makes the ultimate decision. Next slide, please. There were some questions around checklists, so please do use the checklist section of the application to make sure that your application is complete. This is what the checklist section looks like. Hope you've had a chance to take a look at it. Next slide, please. This is just the timeline. So we're now in the kind of the final phase where proposal submission deadline is approaching. That's on May 17th. After that, the Secretariat will screen the proposals for eligibility, then send the proposals to the eligible proposals to the Technical Advisory Panel on June 7th for individual evaluation. And then the Technical Advisory Panel will also have a retreat and finalize its recommendations and submit them to the board of the Pandemic Fund by September 15th. And then after that, the board will consider all the evaluated proposals, and we expect that the Pandemic Fund Board will make its decision by October 21st. Next slide, please. So this is just to say that the Pandemic Fund Secretariat and/or the Technical Advisory Panel may contact you, the applicants, about your application. So please do continue to monitor your email account after you've submitted your proposal. If any additional information or clarification is required, then the applicant will receive an email from the Pandemic Fund application portal with instructions, and this may mean that your application will be reopened to add additional information. So this time there's a feedback loop that we've included. The screening by the Secretariat will take place from May 18th to June 6th. So please make sure to keep an eye on any emails from us. And then the Technical Advisory Panel evaluation will take place from June 7th to the beginning of September, as I mentioned. Last slide, please. And this just provides you with some quick links on how to apply and where to find more information. So once again, thank you so much for your interest in the Pandemic Fund. We really look forward to receiving strong applications. We already see an indication of robust demand, just as we had for our first call. This time there's a bit more time and a bit more opportunity for feedback loops. I should also mention I'm joined here by my colleague Catherine Hudak, who's a health specialist in the Pandemic Fund Secretariat. She's been working really hard on this process. And if there are any questions, Catherine, please also chime in to answer. So back to you, Melinda. Thank you.
Thank you very much, Priyam. I think everybody was eagerly awaiting a lot of that information. We do have a number of questions, but I think some of them you specifically addressed in your presentation. One of the questions an individual asked, and by the way, I think I noticed some people had their hands raised. Please note we won't be calling on you live in this session. If you have a question, please enter it in the Q&A form at the bottom of your Zoom screen. One of the questions had to deal with how many Pandemic Fund proposals can one institution submit. I think you clearly answered that each country should only enter one proposal itself. And if there were multi-country proposals, they really only should have one multi-country proposal from each region. Am I correct in that answer?
Yes, that's correct. So any geographic sub-region, we don't want overlapping regional entity proposals. So, if there's a regional entity, say, from South Asia applying, then, it should, we don't want that same entity submitting applications for the same subset of countries.
Okay. Okay, good. Another question we've received is, are you expecting country letters of support as part of the proposal submission?
Yes, that's correct. So I think that's already indicated there in the portal, just as last time.
Okay, great. And is there a recommendation for how much resources should be allocated to infrastructure within the Pandemic Fund proposals?
I'm not entirely sure what infrastructure, I guess you're talking about sort of buildings and things like that. We don't have
that. Yeah.
Yeah, I mean, we don't have any specific sort of requirement or limit on that. I don't know, Catherine, did you want to come in on that one?
Hi, I would say that it's probably check with your implementing entity to see what they would cover and what they would do, and how this infrastructure aligns to our 3 priority areas, as well as the expected results and the outcomes you're trying to achieve. It would, I think we would need to have a little bit more information on what kind of infrastructure you were talking about. I could see building a lab could be related to one of our specific priority areas, but other than that, it would be hard for us to give more clear advice on that without more specifics.
Okay. And I know we had a technical program, I think it was April 8th or 9th, probably, about laboratories. And I think there was specifically some comments made to avoid, I think, buying lab equipment that didn't feed in well into a health infrastructure. So if there's specific questions around that, I would suggest getting with the laboratory counterparts for more guidance on that as well.
And
Okay.
similarly, you know, I mean, surveillance also, I mean, you know, surveillance may require building a wastewater surveillance plant, for example. So that could count as infrastructure. But yeah, as Catherine said, please discuss with the implementing entities.
Okay, perfect. Thanks a lot. So another question, has the Pandemic Fund Monitoring and Evaluation guiding document been revised yet? If so, can you share it, or when will it be available?
So I believe a guidance note has been put up on the M&E. So I hope you know it's on our website, and it relates to the results framework and the monitoring and evaluation sort of you know, earlier instructions, but it provides a bit more guidance to applicants.
Okay. Great. And I think it would be great if we haven't already, I'm sorry, I'm not looking at the chat, if we can share the link to your site here as well, if we haven't already. Okay, so another question. We're moving through these quite quickly, so this is great. Does the length of the proposal matter, and do countries need to prepare long proposals in order to guarantee funding from the Pandemic Fund? I can imagine how the Pandemic Fund proposal reviewers are thinking about that question.
Yeah, so it's not the length of the proposal that matters, it's the quality of the proposal. It's the strength of the proposal is going to be measured by the quality, the concrete evidence that it provides, the thought that's been given into the proposal design, the engagement of you know, partners, as I was mentioning earlier. So it's not really the length per se.
Okay. Great.
Catherine, did you want to add anything?
Yeah, we actually do have some limits on the length of text. It's really the more clear and concise you can be to explain your proposal, the better. The TAP has a lot of applications to review, so I think if you can get your message across with a few paragraphs, that is just as sufficient as a few pages. You can always add supplementary documentation if you feel that's necessary in the additional material section at the end of the application.
Okay, great. Thanks a lot. Another question about your checklist. The checklist for the applicants in the Pandemic Fund portal and in Part F includes evidence or a request for evidence for involvement of CSOs, community organizations, and non-state actors. Does this mean that we need to upload a letter from the CSO confirming the participation, or exactly what evidence is needed to confirm that the CSO is participating in the proposal development process?
Yeah, so I don't think a letter from the CSO is required, but you know, mentioning it by name and giving some details so that, you know, if the Secretariat or the TAP needs to contact them and you know, check about their involvement and so on. So the more information you can give about these you know, partner organizations that such as CSOs or community organizations and so on, more concrete evidence, name, you know, if there's people that you've been you've been working with and developing your proposal, then provide that information. This is all to kind of make sure that the TAP, when it's evaluating the proposals, has a granular sense of how the depth of those consultations that took place between the applicant and civil society and community organizations.
Okay, great. And we just have two more quick questions, and they're specifically around using the application tools. So one question is, we have a regional proposal, and a note on the project framework spreadsheet says that we should fill in the country level tabs as well. This would duplicate a lot of the activities in the regional tab, as all the activities would be implemented at the country level too. Can we leave a note to just explain instead of filling out all of the country level tabs as well?
I can take this one. So the purpose
let me hand that to Catherine to answer.
Yeah.
So the purpose of the project level results framework is to really be loaded actually into our M&E reporting portal if your project is successful. So we do need all the information in there clearly laid out, especially if there are different outcomes expected at the regional versus the country level, if there's different costing, if there are different delivery partners. So I know that does sound a bit tedious and duplicative, but it's putting in the work now so that later on, if your project is successful, everything's already loaded into the portal and you don't have to go in and redo anything.
Okay, great. And one more very, I think, simple question. I think you may have answered it in the chat, but just so that individuals that are seeing this later will understand the answer as well. So how do we include photos as you've recommended? Because it seems that they're primarily limited to typing and text on the web form.
I can take this one as well. So at the end of the application, in the last section where there's additional materials it can be uploaded. You can upload Excel, you can upload PDF, you can upload Word. I think you might be able to upload JPEG, but what we would like is everything for each section, everything consolidated into one PDF. So if you have multiple pictures, you could put those into a Word document and upload that after converting it into a PDF or something like that. Within the application sections, you're right, it is mostly text fields, but at the very end of the application, I think it's section F, you can upload different documents.
Okay, great. Thank you. So I think that wraps up most of the questions that we've had, and it was nice to see that they're a little bit more practically focused on the application process itself versus philosophically how to apply for the pandemic fund as a whole. I really want to stop and thank our partners for joining us in this webinar series. This is the last of our webinar series. It won't be the last that you're hearing from WHO on planning for sustainable financing. However, it will be the last for preparing for the pandemic fund. I really want to thank our partners at the pandemic fund, Priya and Catherine, for joining us not just on this program, but on a couple of others. Our partner, Katrin Taylor, for joining us from FAO, Tanya Belcheva from UNICEF, and Enkana from WHO. Thank you very much for spending your time today. If participants have additional questions, we really encourage you to email us. I can give the email address in a moment, but there are several other courses and templates and things that you can access from WHO to help your proposal writing in the final phase here. This recording of this webinar and all other in the webinar series will be made available on our website. You can see the full program there. And my fellow teammates can enter in the website to see the other webinar series and the collective list of the Q&As as well, and all the materials that have been shared throughout the series. For additional questions, please email us at whespp@who.int. Again, that's whespp@who.int. And if you please could just take a couple of minutes and scan the QR code there and give us a little bit of feedback so we can further improve on these programs in the future. Again, thanks to our fellow implementing entities and for the Pandemic Fund for your time.